I can help women feel better on the outside and help them feel the emotions they're feeling on the inside with Botox.
Okay, so y'all, I swore I'd never get Botox again. But
it's only taken a year of trying to get her to do this.
Well, hey, y'all. Welcome back to the Dr. Crockett Show. I'm your host, Dr. Susan Crockett. And it's been a minute since I've done an interview. You guys have let me know how much you enjoy them. And you know how we're always doing fun topics about where the scalpel doesn't reach. Haha, it's kind of funny because for those of you who don't know me, I'm a board-certified OBGYN in San Antonio, Texas, and I specialize in robotic surgery. Yes, I'm a minimally invasive GYN surgeon. And my practice is Virtuosa GYN, and I wanted to introduce you one of our very special practitioners.
Hello.
Michelle Self is here today. Michelle is in the house. Woohoo! So Michelle has worked with me for about 3 years now.
Mm-hmm, that's right.
This is the first time you've come on the show.
It is, yeah. And I'm really excited to be here.
Yeah, me too.
Especially getting to watch all the episodes you've put out. It's finally great to be a part of one.
It's like your turn.
Mm-hmm.
Yeah. I'm excited. Why didn't we do this earlier?
I don't
know. But you're here now. So it's a little bit controversial show today for me because this topic I'm a little uncomfortable with, I got to tell you. So before Christmas, I started filming a series about protocols, and I asked you guys to consider how you decide what you do on a daily basis. What are your habits? What are your protocols? And we are starting a series where we go through those protocols one by one. So like, what is your eating protocol? What is your sleeping protocol? And today we're talking about what is your beauty protocol and how you decide about what you do or don't want to do for your beauty protocols. So I had taken my nails off for about 2 months. I didn't film very much during that 2 months. And I let my undernail, my real nail, like grow out and get thick. And I thought, I didn't think I was going to put the acrylics back on. And then they got all grown out and they still were splitting and stuff. And I thought, I feel prettier when I have these on. And because my nails just aren't very pretty. And so I changed my mind. And I changed my protocol. I was like, I'm going to put my nails back on. So today we're talking about Botox.
Yes.
Yes, with Michelle. So Michelle does Botox through our office. So she does a whole lot of stuff in our office, general GYN stuff. And well, tell us a little bit about what you do.
Something that I'm shying away from, not just doing GYN health, is also helping, women feel beautiful on the outside. And that can come from a lot of different things, whether it's what your face feels like, looks like, but also weight management too, because we can feel, amazing on the inside and we can feel super happy. But if our face isn't showing us that, then that's kind of where I come in. I can help women feel better on the outside and help them feel the emotions they're feeling on the inside with Botox, because sometimes we can have issues on the outside that we don't necessarily feel on the inside.
Exactly, right?
Yes.
So a couple examples are when we're overweight, we don't feel good. So a lot of times we as doctors are doing a lot of work within our office that doesn't have anything to do with surgery. That's why this talk is really great for the show, because this show is a wellness show. Mm-hmm. It's not about the surgery part. And so for a long time, I was resistant to doing very much other than just the pure surgery stuff in the office. I didn't do much counseling. I didn't do much weight loss management. I had no aesthetics. Well, it's not true. I tried for a little bit and it didn't work. Mm-hmm. It didn't work out. And I'm not a huge fan of Botox. Right?
Yeah. And I don't know if you want to talk about your experience, but
I think we should.
Okay.
Okay. Because what I want y'all to know about this is I'm not coming on here going, oh, Botox is great. Come do it. The purpose of this show is to talk through kind of how we figure out what we want to do for ourselves, for our beauty regimes, our beauty protocols, and talking about changing those decisions or trying new things as we grow and all the different reasons why we might do those things. So I've had Botox, y'all, twice in my life. I don't have it right now. Like, look at these. I always say you're supposed to have wrinkles on your forehead. right?
Mm-hmm.
No. Okay. So I've had it twice. So the first time was, I don't know if I want to tell this story, but the first time was I had a patient who was a doctor who came to her post-op visit in my office a long time ago. And she brought me Botox as a thank you gift.
That's great.
It was like very persuasive because what am I going to say? No. I mean, she caught me totally off guard. She's like, here, just let me get you real quick.
You did that in the middle of your schedule?
In the middle of my schedule, in her post-op visit. She's like, it'll only take me 2 seconds.
That's awesome.
I'm so grateful for what you did. Let me do something for you. And I'm like, okay.
You can't say no to that.
I couldn't say no to it. And she's somebody who did it in her office all the time. And so I did it that time. And it was the funniest thing. It was a really heavy Botox. And I had kids that were teenagers at the time. Tells you how long ago it was. And I couldn't scowl at them. And they started making fun of me. Like I had no expression at all. And
oh, that's good.
I would be like, lecturing them, and they would just laugh at me. They point at my forehead and just laugh like, Mom, are you?
I'm going to have to ask Lindsay about this next week.
So after that, I was like, I'm never doing that again. And I have done some other things. So I got a blepharoplasty a couple years ago, which was awesome because
yeah, absolutely.
I had like 30% occlusion of my head and eyes, young, go back and see pictures. And I've had fillers. It's been a while since I had that.
Oh, really?
Yeah.
What do you think about the fillers?
I loved the fillers.
Really?
Yeah. So, in fact, I've been thinking about going back and getting a little bit more. They just did a little bit here, which took up the puffiness here, and a little right along here, which took some of that ridge out. But I got a lot of fat in my face, so I don't need a lot of filler. So I swore I would never do Botox. And then when I started working with my plastic surgeon for the eyes a couple years ago, they talked me into it in the office and they were like, let's just do the fillers and some Botox and stuff. And what they were trying to do is lift my eyebrows up before my surgery. We were trying that before we did surgery.
Yeah.
And I ended up like I did not like it. Like my face felt like flattened and wide and the eyebrows were weird. And I was like, okay, I'm not doing this anymore.
Well, I think that everyone's experience with Botox is it's totally different. And sometimes we do Botox for a lot of different reasons.
Yeah.
And,
so tell me some of what you see, because it was kind of interesting to me as we started talking about what women come in with and why they do it and how they make those decisions.
Absolutely. So I've had, just the basic, like, I don't like lines on my forehead. I don't like these crow's feet. I don't like the scowling 11s. And so there is the cosmetic feature of wanting to kind of minimize lines and look youthful. But there is also, actual features of our face that can, be not necessarily fixed, but it can help with like functionality of things. And I think it's a really good point that you brought up that your plastic surgeon wanted to do the lift in your eyebrows, because that's true. As we age, we're going to have that laxity in our skin. We're not always going to have the tight skin in our face. It's going to become lax. And so sometimes that can be heavy on your face. And so just recently I had a woman in about her early 70s, and she came in and she just hated that she was always being told she had RBF.
That resting bee face?
The resting bee face, yeah. And she really didn't, but it was just she had so many lines and so many years of, having that loss of elasticity that she just had this RBF. And so we did just very light Botox in her forehead, just right in here. And it really helped smooth out her face. And so she was able to give her true expression. It wasn't just about cosmetic feature. It was truly helping like portray to her family she doesn't have an RBF, and people were
she's not mad all the time.
She's not mad all the time. Yeah. And so she was super happy with the initial set of results and came in and we went a little bit heavier with some Botox, and she's really happy with where she's at, even now 3-4 months later.
Well, that's a testament to your skill also, because honestly, when you first came to me and said, Dr. Crockett, I want to go get trained and do this, I was like, I've been so like, just stick to the medicine thing. But you were so passionate about it and you were so excited. And, I'm up for trying new things. So we've added a couple cash pay lines now. And this time successfully. The vitamin line is launching. And and we've got some hormone replacement therapy that's really helpful. And so I thought, okay, this isn't like trying to bite off a whole lot. It's not a big deal. It's a little thing. Let's see what you can do. Let's see how it works. And so you came back and you got trained, and then I watched you do an injection on one of my friends, and it was really amazing to watch you do, because you have quite an artistry. You have an artist's eye when you do it, and not everybody does. Like the first one for sure that I had done was pretty clinical. And I think having somebody like you that has some knowledge about all of the physiology that's going on with the muscles underneath and the different types of substances that you're using are, I think that makes a big difference. So can you talk a little bit about that? Like how you determine the placement and how much and the different types of Botox that you use? Yeah.
Yeah. So I think that I absolutely agree. It is an artistry. And I think it's also really important to go and have Botox done with someone who has had, one, the appropriate training, and two, the appropriate licensure to do it, because you're very right. There's people who will just take the clinical approach and, oh, the book says do here, here, and here, and I'm just going to put it there. But I understand what muscles I'm trying to affect. I understand what I want to paralyze with the neurotoxin, because it's a neurotoxin and it's a very serious decision to make. And so if I can be intentional with where I want that Botox to go, it's going to give you the best results. So choosing the type of Botox is absolutely even more important, because there are some women who, they're new to Botox. Like my 70-year-old coming in, she's very new. I'm not going to put the most heavy type of Botox, which would be something called Dysport, which lasts a very long time. That's like 6 months of her being with something she doesn't like. So I wouldn't do something like that. That's the very long acting and very, very heavy Botox. But then there's also Xeomin, which is probably my favorite and definitely what I recommend mostly for women who are either on the fence or just not sure, or they have been doing Botox for a long time and they like the light feeling of Botox and not being completely frozen. Because you don't want to be looking at someone and like, I'm very upset with you right now.
Right. Like my experience was at the beginning.
Yeah. I can't show you how I feel, but I like Xeomin, which is what I try to, encourage for everybody, because I like to refer to that as like the feather Botox. And feather Botox is exactly how it sounds. It's very light. It's not going to make you feel like you have a 5-pound weight on your forehead.
Yeah.
It's not going to keep your eyes from shutting. It's not going to keep your mouth from being able to suck on a straw. That is my favorite. But then there's Botox, which is just the very traditional Botox. Women who have come and had lots of Botox in their life, I'd probably recommend something like that, because some people like that heavy feeling. And it's really funny because one of our employees that I do her Botox, every time I do her Botox, she's like, oh, I love the way that it pops when you hit on my forehead. And I'm like, that's kind of weird, but okay, if you like it. And everybody has different preferences, but I always try to educate with, what I think would be the most appropriate, because that's part of the artistry of Botox, is making sure you're communicating what they think they should have, but also incorporating them in the decision on where they want Botox.
Yeah, I think those are really good points. So I think before I had you working like this in the office, I didn't even know that there were all those different kinds or options. And all that. Okay, so y'all, I swore I'd never get Botox again. But
it's only taken a year of trying to get her to do this.
Here's what we're going to do. This is my before. We are not going to show you the actual injections on TV because I don't want to show that's too much.
It's not much.
But let's show you looking at my face and marking my face.
Okay.
And this will be the beforehand, and then we'll come back and do an after.
Let's do it.
Okay. Yes, I have faith in you. I've seen you do this before, and I know you're an amazing artist. I'm a little nervous, but that's how everybody feels. Right?
So, absolutely. Okay. Absolutely. I'm going to absolutely make sure that you're comfortable with all the points that I'm going to make before we do any injection.
Okay.
Because this is about you and how you feel. So if you don't like where the points are and you're like, I don't want to do that, just let me know and we can readjust.
Okay. I've never had this done before.
Okay.
Yeah. Okay.
Right. So, let me work.
So what you're doing right now is working with a crayon.
Yes. So this is my marker, and there's a lot of different injectors who won't use markers and they will just go straight in. But something I don't like about that is it doesn't really get to involve you in the decision-making process, because we're ultimately wanting you to feel good about how you look. And if you don't get to take part in that, what are we even doing here?
I like how you put that. That's part of what we were talking about before, about reflecting what's going on inside the person on the outside.
Yeah.
Yeah.
You get to do the surgeries on the inside, and then they get to come see me, and I'm like, hey, let's do outside stuff too.
Okay. Fine. It's a good setup.
Since we want to start light with you, I think that this would be a really great starting point.
Okay.
And do our feather injections, do our Xeomin, and then in 2 weeks, if you are kind of like on that hungry, like this feels good, I like it, then we can go a little bit heavier at that time. But it generally takes about, with Xeomin, what's great is you'll see some results in about 3 days, but full effect will be about that 7 to 14 days.
Okay.
So in 2 weeks, we can check back in and see when you're ready for more.
Okay.
Good.
All right, now what?
You ready?
Yeah.
Okay. So I'm going to do, I'm only going to do one in these. One. Can I maybe do two? 1, 2, 3, 4, 5, 6. So 19 units. Not very much.
That's not very much.
Not at all.
Okay.
I've got 46 in me right now.
Oh my gosh. That's a lot.
That is a lot. I'm actually frowning.
Welcome back to the Dr. Crockett Show. This is the after. This is Michelle's self. We just took a little break, and I don't know if you can see or not, but I let her do Botox on my forehead. So it's a little bumpy. It really wasn't bad. You did a beautiful job.
Thank you.
You used the feather.
The feather Xeomin. So we should actually, when I see you this next week in clinic, we should already start to see a little bit of some,
Softening.
Yep, exactly. And then in about a week, you'll probably be a lot more softened.
So that my outsides look as happy as my insides are.
Exactly.
Yeah. So we always talk about how on the show we're going where the scalpel doesn't reach, but in practice, that's what I'm doing. I'm always fixing everybody's insides.
Yeah.
It's kind of different to sit here working on my outsides. So
It is.
thank you very much.
You're absolutely welcome. And I'm excited to see results.
I am too. I'm a little nervous. Seriously, y'all, I woke up this morning and I was like, there is no way they're doing Botox to me today. There's no way. I know she's going to bring it. We didn't plan this. I swear to y'all, we did not plan this.
We didn't.
We knew we were going to talk about it, but no, she walked in. I'm like, no. And here I am 30 minutes later.
Very light Botox.
It is. Thank you so
gentle.
much.
You're very
I appreciate
welcome.
it.
You're very welcome.
Y'all have a wonderful week. And I want you to think about your own beauty protocols for yourself. Maybe it's your makeup. Maybe it's not wearing makeup. Maybe it is just getting a good night's sleep or washing your face every day, like your mama used to tell you. I hope you have a wonderful week. We will see you next week on the Dr. Crockett Show. And if you want to have your Botox done and you live near San Antonio, come see Michelle's self at Virtuosa GYN. We'll put the link down below. Y'all have a great week. Thank you. Bye. Oh, and stay tuned to see what the result of this looks like in 2 weeks. Yeah, I'll be on the air. We'll see ya. Bye, y'all.